So Brian, tell me about your experience with the AddOn IOL.
Yeah. So I'm Brian Harrisberg, and I've been using sulcus-based lenses for about 20 years. It's a perfect place in a pseudophakic because you can add and alter power the way you want it. But in the beginning, they were all C loops, and we had issues. They rotated. So that's when I was introduced to the AddOn and started using it across the board in many versatile situations. How have you been using it?
Well, as you mentioned, it's a secondary sulcus supplementary lens designed for pseudophakia. So it has a wide variety of applications. I'm mostly using it to upgrade people's vision, where they've either got residual refractive error and laser vision correction enhancement is not the best procedure for them. For example, if they're hyperopic, or they did not have discussed with them the option of multifocality. So I love that part of the ability to upgrade the vision with multifocality. And I understand that you have a really large amount of experience with doing two lenses at the one time. Can you tell me a little bit about that?
Yeah, so what I like about it is easy in and easy out. So if you know the technique, it's definitely something you should consider as a cataract surgeon, assuming you're not always going to the cornea for refractive correction. And in the multifocal category, these patients sometimes are unsure. So we can't say you should or shouldn't do, so offer an alternative. And that's the dual procedure, where we get one lens in the bag, monofocal power, outside the bag, multifocal. Why? You're not happy, you're not coping, we can reverse this. But interestingly, I've never had to reverse it.
That's right. So it gives that reversible option to the multifocal portion. So when people are considering doing the dual procedure, where they're putting in two lenses at the time of the initial surgery, it is important, isn't it, to correct all of the refractive error in the bag lens.
Correct.
And have the secondary sulcus add-on lens
Yeah,
as a plano multifocal.
that's right.
Because
So,
if you ever do need to reverse it, and I'm like you, I've never had to explant a lens.
and we got the multifocal in the bag, it's got 7 rings, but the add-on's got 6 because it's closer to the pupil. And surprisingly, I've seen better centration with the add-on rings compared to in the bag rings. And if you look at the data, it's the same. Distance near intermediate, it's equal.
Yeah. Okay, so I hadn't noticed actually that my outcomes were much improved compared to the Liberty IOL
No, same.
and the add-on IOL with the slightly different design with 6 rings on the add-on versus 7 rings in the Liberty, because actually both of them have such a low dysphotopsia profile compared to a lot of the other trifocal lenses on the market, and they still have that trifocality.
Yeah.
Yeah.
So it's trifocal for 3 millimeters, and it's monofocal in the 3 to 6 millimeter zone. And the dysphotopsia is less. It's mainly halo, less dispersion.
Yes. So let's talk a little bit about other applications to use the add-on, because
Yeah.
personally I've used it in strange corneas where it's very difficult to determine what the keratometry actually is. It's very inconsistent across multiple devices, even after you've optimized the ocular surface. So that might be keratoconics, pellucid marginal degeneration, corneas that have had really high previous myopic ablations, -10 plus ablations with laser vision correction, scarred corneas, those sorts of things.
Yeah, so the issue often with our data is, where is the axis? We're usually pretty
And
good
the
on power. We're
Yeah.
usually pretty good on power. But what I'm getting is 3 different axes across different machines. So if you put the secondary toric in the sulcus and it's not right, we can rotate it. We don't have to dig out a lens out of the bag. That's the point. We want to save people from this.
Save people from having to have IOLs explanted, because being able to take an add-on lens out of the sulcus
Yeah.
is much, much easier. And, when we're correcting toricity after a primary procedure, we base it on the subjective refraction. And the great thing about the AddOn IOL is the way the haptics are designed and that rotational stability.
Yeah.
Have you
So-
ever had to go in and rotate an AddOn IOL?
Not yet.
I haven't.
Not
yeah.
yet. It's 4-point fixation, and
Yeah.
I know it's stable. I've proved it. But I want to encourage all cataract surgeons to consider this lens because it's sort of your get out of jail card.
Yeah, it is. Yeah. So many great applications of
Yeah.
this AddOn IOL.
Thanks, Alison.
Thanks, Brian.